In a moment here, we've heard about a woman's biological clock ticking. It turns out that men might have to think about having children before their time runs out as well. We'll get to that in a moment here.
Oh, I so love that.
Oh, yeah.
Oh, it all comes out now. It's not just women, it's men.
Time's going, Carol. Come on.
I knew you wouldn't want to talk about that.
While women of a certain age may be ever mindful of their biological clock, men, it turns out, might be ticking as well. Dr. Harry Fisch details the decline of male fertility in his new book called The Male Biological Clock. Dr. Fisch is my guest here in New York. Good morning to you.
Good morning.
The women love this story, by the way. We brought it up with Carol. She liked it. Kelly wanted to listen. Men don't like it, do they?
No.
Stay away from it.
Yeah, it's something that really affects men. It's a way of thinking that's totally different. Blaming ourselves for some of the problems that are occurring with fertility and sexuality is a big topic.
Let me get to some of the items here. You say there were 3 factors. What are they?
Well, when we think of a biological clock, we think about women. And what we think is a decline in fertility, a decline in hormones, and an increase in genetic problems associated with age. And that's exactly what's happening with men as we age.
What are the factors that lead to lowered fertility?
Well, there's a lot of factors. There's a lot of medical issues that occur. But I think one of the biggest things is a lot of things we do to ourselves that really affect our fertility.
Such as?
Well, weight gain, poor diet. In fact, we now know that there's a heart-hormone connection. That is, what's bad for the heart is bad for the hormones, sexuality, and fertility.
Can you reverse this?
Yes, you can, to some degree, not completely. But some men have biological clocks that tick too fast, and some are more in line with the way it should be. So things like general health are very important. Quitting smoking, excellent diet, lower cholesterol levels. These are things we could do for ourselves.
You've mentioned a few things. Let me go through them. Male fertility, keep weight in check. You mentioned that. Diet is always important, right?
Yeah, it's very important because we now know that excessive weight is associated with lower testosterone. That is, men who have big belly fat have lower testosterone.
It kind of goes in sync with the next one. No smoking.
That's right.
No cigarettes, no illegal drugs. Why does that have an impact?
Well, cigarette smoking is terrible for the heart, for the blood vessels, for hormone production. It's just an awful thing we do throughout the world. We're seeing less of it now in this country, but I think the less we smoke, the better it is for our general health, which means general health means better fertility and better.
Help me out with this one. Limit use of hot tubs?
Right. Well, we do know one thing, that anything that heats up our testicles, for men obviously, anything that heats it up causes a decrease in fertility. Any heat. So hot tubs are very, very bad for it. Other conditions such as varicoceles, which are engorgements of veins around the scrotum that we see in adolescents, can adversely affect fertility as we age. And that's something that we need to really evaluate, even younger at younger ages, because that's something that could really speed up the clock.
You wrote the book, The Male Biological Clock. That's why you're here today. Are you the only one talking about this? Or others?
There's not a lot talking about this. I'll tell you, there's not a lot. Women want to hear this. Men don't.
It makes them feel better, doesn't it? We're out there saying we're not the only ones, right?
Well, we really are not the only ones. And some of the problems that we've had with fertility is that a lot of times it's a male problem. And yet we ignore the male for a large degree and treat the women, even though it's a male problem. And I think I'd like to see some of that change, really evaluate the male, because infertility and sexual problems are really portals to men's health. That means if you have a fertility or a sexuality problem, you may be unhealthy. And that's very important.
Good to know. Carol and Kelly are happy. I bet Soledad is too. Thank you, Doctor.
Thank you.
Back to D.C.